I'm Dr. Randall Flick, Chair of the Division of Pediatric Anesthesia at the Mayo Clinic. When parents bring their children for a surgical procedure requiring anesthesia, there are many questions that parents will ask, some of which relate to the surgery, but many relate solely to the anesthesia. The first question that we often are asked is, what is the risk of anesthesia? The risk of anesthesia for children is different than that for adults, but it's important to keep in mind that anesthesia is very, very safe, and even though pediatric anesthesia is slightly more risky, the risk is very, very low. Most of that risk is confined, is confined to the very young, infants, toddlers, and as with adults, the risk tends to go up much higher for children with complex problems, emergency surgeries, and the like. I think it's important for parents to recognize that your child will almost certainly do well in all aspects of anesthetic care, and they should be reassured that their child can safely undergo anesthesia. Recently, there have been some reports of the effects of anesthesia on learning in children, and specifically that exposure to anesthesia in the very young may affect the ability of that child to learn or their performance in school. Those studies are ongoing, some of which have been done here at the Mayo Clinic. The Food and Drug Administration, those of us carrying out that research here at the Mayo Clinic and elsewhere, caution parents to recognize that these studies are very preliminary and shouldn't be part of the decision-making process with regard to surgery for children, at least until we have more information. We don't want to avoid important surgeries for young children because of a risk that's really not well defined, at least as yet. Parents have other questions about anesthesia in children. One of the more common ones is, if my child is sick, can they still have surgery? Well, this is probably one of the more common reasons that children's surgical procedures are canceled. That being typically a respiratory infection around the time of surgery. The problem with a respiratory infection around in association with anesthesia is that children will tend to have more complications associated with anesthesia than they would otherwise. Problems with the need for prolonged stays in recovery, the potential to be admitted to the hospital because of problems breathing after surgery, and very, very rarely more severe problems that would, for example, put a child in the intensive care unit. These problems are quite rare, and most of the time a child with mild symptoms of a respiratory tract infection can undergo whatever surgical procedure is needed without undue risk. However, if a child has symptoms that are consistent with pneumonia, or what we call lower respiratory tract infection, or they have a fever, those are things that will often prevent both the surgeon and the anesthesiologist from scheduling a child for surgery. Another frequently asked question that parents have is feeding instructions before surgery. This is another question that leads to confusion, I think, among parents. The American Society of Anesthesiologists has a uniform recommendation for adults and children with regard to preoperative fasting, or when can or should not a child or adult eat or drink prior to undergoing an anesthetic or surgical procedure. In general, children and adults should refrain from eating solid foods for at least 6 and preferably 8 hours prior to a procedure. Clear liquids can be consumed up to 2 hours and should be consumed up to 2 hours prior to a procedure. Clear liquids being liquids that you can see through or light passes through easily, like apple juice or Pedialyte, water, soda, and those things. Orange juice or things with pulp in them, milk should not be consumed proximal to the surgical procedure. Breast milk can be consumed for young infants up to 4 hours prior to a procedure. And again, I think it's important for parents to be encouraged to offer clear liquids to their child up to 2 hours before the planned time for the procedure. That will help them not only help them, but help us in the operating room. Other questions about anesthesia often revolve around what happens after surgery, the problems that may occur with children in the postoperative period, pain management, the likelihood of the need for hospital admission for children who are scheduled for outpatient surgery. Those questions are often difficult to answer in the absence of specific information about a particular child. It's certainly true that the most common reasons that children are admitted to the hospital when they were expected to go home would be nausea and vomiting and pain. We do everything we can to prevent those problems and to deal with them when they occur, but rarely a child will need to be admitted after a procedure when it was hoped that they would be able to go home.